Um, so as a reminder, this is a speaker series for the Ohio University REU program and the RISE program at Nationwide Children's Hospital, which consists of undergraduate and graduate students from a variety of uh, universities across a broad geographic area. Eric Youngstrom directs the RISE program, and Fran Wims, who I think I saw join here recently, is director of the REU program. So our speaker today is Dr. Andy de Los Reyes, who's a professor of psychology at the University of Maryland and director of the Comprehensive Assessment and Intervention Program, and he's also the editor of the journal Clinical Child and Adolescent Psychology. And he is also going to be is directing the Future Directions conference that some of you are going to in Columbus in a few weeks. So you'll get to see him in person at that point in time. So as we've often done, he's going to present some of the work that he does first, and then there'll be time for questions from anyone about a broad scope of things, including the content that he presents, as well as how did you get to this spot in your career? What would you do differently if you were back in graduate school? What's all those kind of professional development questions that are relevant to undergraduate and graduate students who were selected for these two programs because of how successful and research oriented they are. So I'm sure that'll be a rich opportunity for them. So Andy, if you don't mind, just could you start by giving a few sentences about the conference in a few weeks and then go into your talk?
Most definitely, Steve. Actually, there was a little slide at the very beginning. I was going to do a shameless plug anyway. So thank you for setting that up. And thank you so much for the really kind introduction. It's great to see you all. It's going to be a delightful excuse to talk about a topic that I care a lot about, and then that's rivaled by the fact that I'll be talking a lot about the forum, and happy to answer any questions you might have. Let me see. Oh, see that. Let's see if that shows up. Can you all see my screen?
Please read the fine print. Yes.
Yes, great. All right, great. So before I start this talk, which, by the way, any of you who will wind up seeing talks about measurement invariance, you'll see a noticeable difference between the talk I'll be giving today and any future talk about this topic, and that is that we will not be seeing a single equation. Nothing. I'm sorry, y'all, about not showing you any equations. And the reason why is because I think a lot of people are not reading the fine print before they get to the equations. But before I do that, shameless plug for the Future Directions Forum. You're only 90 minutes away from this place. At the end of July, we're going to be doing our 8th Future Directions Forum. There's a QR code on the screen that'll take you to a Dropbox folder that includes a full description of the content. It's just an awesome meeting. We're going to have a series of addresses about issues surrounding research on mentoring, so big brothers, big sisters. Tim Cavell's giving an address on that topic, and Henry Willis is giving a really great address on culturally informed mobile health platforms, so research on mobile health. Those are our addresses, and they're inspired by a series that we have in the Journal of Clinical Child and Adolescent Psychology called Future Directions, where folks give us a sense of where they think the next 2 years in a topic of interest or a topic of expertise of theirs is going. They're really inspiring papers. They make for great addresses, and so those are like the top line presentations that we do at the forum. All the stuff underneath is where all the magic happens. So we do in our forum. We invite a bunch of presenters across a whole bunch of areas of research to deliver workshops, hands-on practical workshops about all elements of conducting research, publishing, navigating burnout, identifying safe and affirmative spaces for conducting research, imposter feelings. A colleague of ours, Dante Bernard at the University of Missouri, is going to do an entire workshop on imposter feelings. just a whole host of really great workshops. Here's the neat thing. We do the workshops. You've probably seen a bunch of those at a bunch of conferences. What you probably haven't seen is the opportunity to meet one-on-one and in small groups with the same people delivering the addresses in the workshops. Our scheduling is of such we do the workshops and the addresses in their own dedicated blocks, and then we have an entire dedicated block, 1 hour blocks dedicated to small group and one-on-one consultations about all the different kinds of things that you want questions answered to, about papers you're working on, applications you're going to be submitting to grad school, or other kinds of different things you're focused on. A whole bunch of different things in relation to tailored consultations germane to the work that you want to do. So just 90 minutes away. It's going to be a lot of fun. Probably the most compelling programming we've ever put together. And that's saying something because every year we have a lot of fun doing this. Oh, Elizabeth Capps, one of your colleagues in your program is doing a poster presentation at this meeting. Do you know that at the Future Directions Forum, no one prints out their poster? Our poster sessions are completely digital. It's like walking through an art museum where the pieces change every few minutes. It's really neat. A lot of fun. So any questions you have about that? Happy to answer them. Before we start going to measurement invariance, I want to get to know y'all a little bit. All right, so we're all here because we're curious. We care a lot about research. We care a lot about research about specific topics like, anxiety, ADHD, parenting, social skills, depression. And in particular, we care a lot about their causes and consequences. Why do they appear? Who do they impact? What are their impacts? And what's really going to be important and germane to this discussion is for us to sort of figure out what aspects of these domains, the kinds of things that you study, what are those things you care most about? Feel free to share your thoughts in text, on chat, in audio. I want to get a sense of where you all are coming from in terms of the work that you do or the work that you aspire to do. What are some examples? Children and families. Yeah. What else? Show of hands. Interest in ADHD. Show of hands. Okay. What about parenting? What about parenting? Who's into parenting? Yeah, okay. Depression. Interested in depression? Anybody? A little bit. Tad. You dabble in it. I do as well. Social skills. Yes, and Eric, test and measurement invariance. Indeed. Good, that's going to be helpful. Keep those ideas in mind, keep those domains in mind as we keep on going. Okay. So I want to give you a sense of where I'm coming from with this. So as Steve mentioned, I spent a lot of time in my lab thinking about measurement, how to ascribe numbers and symbols to the kinds of things that we care about measuring, how to give advice to folks about measurements, particularly when different things that you think are measuring the same thing are actually giving completely different numbers or symbols or results. All right, that's a big focus of my training in the lab, what students work on. It also plays a key role in other parts of my job. And so, as you probably noticed from seeing or getting a day-to-day sense of Steve's work and Julie's work, and in some of your cases, Eric's work, you all know that we wear lots of different hats. As Steve mentioned, I edit a journal. I spend a lot of time thinking about measurement among the papers being submitted in the journals. I care a lot about measurement in the context of this new role that I took on earlier this year. I'm co-chairing a committee that works on the guidelines that people follow when they try to interpret the scores taken from instruments used to assess people clinically and assess people in education settings and a bunch of other applied settings. It's measurements, a core component of a book that I have coming out in a couple months, and a class that I'm going to start teaching next year. You know, both in form of the book. You know, I spend a lot of time thinking about measurement, and one of the things that I pay a lot of attention to are circumstances in which people are using or implementing methods that on the surface might seem like a good idea to implement, but they may be using or misusing these techniques, and in fact misusing to the point where they might be having the opposite effect of what they intend to do when they implement them. So today's kind of like a cautionary tale on that, on one particular topic, one particular technique that people are using, and the reasoning behind the technique we'll be talking about, measurement invariance, it revolves around this constant state of tension that researchers in mental health often find themselves in. And the tension starts off with this notion that as scientists, we care a lot about precision, we care a lot about accuracy, and we care a lot about both of those things because we know that when we administer assessments to people, whether they're in a sample or they're part of a caseload of clients you're seeing in a clinic, you know you're going to get different numbers. You're going to get a 10 for one person, and a 5 for another, and a 3 for another, and a 2 for another. And the last thing you want are those numbers to vary from each other like leaves blowing in the wind. They don't matter at all. There's no meaning between it. There's no meaning in the space between a 10 and a 5 or a 3 and a 1. You don't want that to happen. If anything, what you want is value. You want to be able to say to yourself with confidence that the 10 and the 5 mean something different. These numbers are personally meaningful to those people, and then you can start distinguishing between needs for services, levels of a concern, levels of a domain that someone's experiencing. This person has a higher degree of ADHD symptoms than this person, and that's going to help inform me, help inform my understanding of who might meet criteria for diagnosis and might not, who might need services for this condition versus not. Is somebody getting better over the course of treatment versus not? Precision, accuracy matters because we care about being able to interpret differences among scores in a meaningful way. All right. And that's where measurement invariance really comes in. So we're going to spend the rest of our time here thinking about what this technique is, why people implement it. You know, this is a core thing. What are the things you have to assume when you use that technique? All of our techniques have this. If you run a t-test, you are assuming that the dependent variable you're entering into that test is normally distributed. You know, there aren't a whole lot of outliers. There aren't confounding factors in the distributed properties of those of the scores you're entering. We make all kinds of assumptions about things before we use them. And what are the consequences of what quantitative folks call violating those assumptions? What are the consequences of violating them? Of using a technique when the data you're applying it to don't meet the assumptions of the technique. We're going to talk about some great examples of where people use this, which we use it with very powerful effect, and some places where there might not be strong grounding for their implementation. We'll talk about the consequences of what that might mean, and then provide some principles to follow when thinking about whether or not you might use these techniques. And the reason why I'm talking about this with you all now, at this stage in your career, is that at some point you might find yourself making your way into a graduate program, into a laboratory where people are using this a great deal. And I know that because you see these papers everywhere now. People are using measurement invariance to try to see if we should be equating the item responses that different informants have when they rate the same thing, like a parent and teacher rating ADHD or a parent and adolescent rating anxiety. You'll see people look at try to make things equitable, try to make measurements equitable in the context of temperament. And in this case, it's not two different sources. It's different people with different identities, differences in sex assigned at birth, differences in gender identities. You'll see these techniques being implemented to understand if we should be making measurements equitable before and after treatment. All right, so now we're thinking about trying to make things equivalent across time. All right, so within a person. We see the same thing with parent-teacher ratings. If you're rating ADHD and you know that one of the diagnostic criteria are the manifestation of symptoms and impairments across context, does this mean we have to make the item responses on parent and teacher ratings on the same instrument the same? parenting, do we have to make sure that the way that we measure parenting is more or less equivalent across the age of the child, of the parent's child, the gender or identity or sex assigned at birth of the child, whether or not they're in treatment? Depression ratings. Should we ensure that that ratings of depression are equivalent across people with different kinds of racial ethnic identities? It's everywhere. All right, and it's everywhere for these key reasons. We want to make sure that under the right circumstances, our instruments are measuring things in more or less the same way across a bunch of conditions, across racial ethnic identities, ages or periods of development, across time, sometimes across experimental conditions. And one of the key reasons why we're doing that isn't just a research kind of thing, that we want the constructs to be equivalent across conditions. We also want to make sure we're measuring things fairly and equitable. We want to make sure that when people are completing our instruments, regardless of their backgrounds, regardless of who they are, regardless of what period of time that they're completing the assessments, they have a fair shot at providing responses on these instruments that tell you something important about who they are. The key thing with the measurement invariance, though, is that we're really only using these things when we know the evidence supports the idea that what makes things different, what makes things unequivalent, are errors and biases in measurement, and we see that in the fine print of the definition. This is on the very first page of a classic text on measurement invariance written by Roger Millsap. And it goes, measurement invariance is built on the notion that a measuring device should function the same way across varied conditions, so long as those varied conditions are irrelevant to the attribute being measured. Right? Over the course of the talk, we're gonna talk about how that word, irrelevant, is the most important word in this definition. Nothing else matters unless you rule this element in or out of what data you're using. All right. So let's go back to the domains we were thinking about earlier on in the discussion. Right. ADHD, parenting, social skills, depression. Mention some things in the chat about things pertaining to the domain that you think are relevant for thinking about that domain. What are some factors that pop in your mind? Like is the age of the person you're assessing relevant to thinking about their ADHD symptoms? Show of hands on that. How old that person is, doesn't matter. All right. The age of the child you're parenting, does that matter? Show of hands. Does that matter at all? All right. All right. The gender identity, the sex assigned at birth of someone who's experiencing depressive symptoms, do those factors matter when it comes to depression? All right. Yeah. So we're seeing hands. We're seeing hands here. All right. Good. Okay. Good. All right. So let's think about. That's good. We're thinking about these things because again, matters a lot. Matters a lot for what we're going to be doing. We're going to be talking about here. All right. So we're sharing our thoughts. And here's the first place where we start thinking to ourselves, this really, really matters. All right. This is another quote from that same textbook, first couple pages. And it's a really nice example of a place where measurement invariance matters a lot. So let's say you're trying to weigh two things. You know they weigh the same. They both weigh 80 pounds. But one is shaped a little bit differently than the other one. Maybe it's got jagged edges and the other one doesn't. Maybe the other one's smooth, the other one isn't. But for some reason, the weight scales are giving you different weights. They're not both 80 pounds. So it looks like shape is impacting it, but you know in advance, all of us know that from a physics standpoint, how something is shaped is not relevant to understanding its weight, particularly making sure that the two different things that weigh the same show the same weight readings. Right? That's a big portion of these techniques, right? You have to be able to say to yourself that something is irrelevant before you conduct these tests. And the reason why that is that it's really easy to find circumstances where people vary on domains we care about, and they vary systematically, but in ways that are linked to their backgrounds, right? I mean, take a look at the opening page of the diagnostic criteria for any of the conditions we study, like in the DSM. These are all associated features of big chunks of our diagnoses. They vary systematically with our participants. We know this, all right? And I'm actually going to show you some examples of relevant theory about this later on. And so in this context, consistent with the definition, you're only supposed to be doing these kinds of tests if the data suggests ahead of time that you should, right? So if they must occur before conducting the test, these tests can't be implemented in kind of the same ways that you saw with the earlier studies. These aren't tools for discovering things that are inequitable in your assessments. That's done ahead of time. That's homework that then informs whether or not you're conducting the test, right? And in the context of measuring individual differences and making sure your assessments are equitable and fair, what you're basically asking the question is, does prior work tell me that I should be conducting these tests? I think of this kind of like a straight face test in of itself. Like, so can you say to yourself with a straight face that treating anxiety is irrelevant for understanding changes in anxiety? Are the contexts in which people experience ADHD symptoms irrelevant for understanding ADHD? Is a child's age, their clinical status, their gender identity irrelevant for understanding how someone parents them? And does someone's racial ethnic background, is that irrelevant for understanding depressive symptoms? Because if the answer is no, they're actually relevant, none of these studies should have occurred. The reason why that's important is because these studies are the origin stories for fixing the assessment. And by that I mean, when we realize that things aren't equivalent, what we do afterwards is, typically, let's pluck items out of that instrument until things become equivalent again, right? And so if you pluck out those items and you're wrong, you're literally taking out opportunities for your data sources, for the people responding to your instruments to actually give you meaningful information about who they are and what they're experiencing. To the degree the measurement invariance is a way to produce or to ensure equity in assessment, if you use it in the wrong place, you're actually creating disparities in assessment. You're removing opportunities for people to tell you who they are. So let's think about this again. So I asked you about factors you think are relevant for understanding a few different kinds of these domains, all right? So within those domains, why? Why do you think, what's the reasoning behind thinking that how old someone is relevant to understanding their ADHD symptoms? What's the theoretical model you're following? Let's think of some examples. Like we see that maybe that factor might be impacted, but what are some of the ideas that inform those kinds of things? What are the theories? Right, so like theories about self-regulation, about cognitive patterns, about thinking. Right. What else? We'll talk about a few more too, but I wanted to get your all's ideas on or your mindset thinking about that connection between theories and evidence. So, and the reason why that's important is that theoretical grounding in thinking about these differences is paramount to identifying places where measurement invariance has been applied historically and to great effect. So There's a long line of work on the notion that someone's racial or ethnic identity doesn't play a big role in explaining variations in intellectual functioning. That grounding in theory, that grounding in evidence, has led to decades of work on trying to ensure that tests of intellectual functioning are fair, so that items that differentially produce responses among people with different identities are just plucked out, and the ones that remain are the ones that wind up driving interpretations of scores. One of my favorite examples of this, Janet Hyde's gender similarity hypothesis. There's a colleague at the University of Michigan spent their entire career testing notions of the degree to which one's sex assigned at birth impacts or plays a role in understanding individual differences in cognitive function. The answer is not that much. The effect sizes are tiny across a host of different kinds of tests of cognitive functioning. For that reason, if you were to administer or implement a cognitive functioning task of some sort, you're plucking out stimuli that differentiate people with different kinds of identities or sex assigned at birth. All of us can kind of agree that it's not just not just based on theory and evidence, but also based on morals. That you don't want to hire or fire someone based on who they are, right? There's like laws against this. So as a function of that, when you're administering these kinds of tests, you're plucking out items, you're plucking out content that systematically create differences between people with different identities, different kinds of backgrounds. These are great examples of where measurement invariance is used to its optimal or valuable effect. And there's a bunch of places in mental health people are using these things, and the evidence points to people not doing them. The last thing you should be doing is conducting these tests. Let me show you a few examples. In my line of work, so I spend a lot of time thinking about when differences in rating the same thing produce different results. And there are a couple different hypotheses as to why this might be. One hypothesis sort of says that these discrepancies are largely accounted for by rater biases, and in particular, rater biases that are reflective of differences among data sources in their affective states. That if so for instance, if you're depressed and you're rating your child, you're more likely to attend to, encode, remember, and then use information that's more negative about that child, about your observations, than positive neutral information, relative to people who aren't depressed. Right? Long-standing theoretical concepts, not a lot of good evidence to back it up. Situational specificity, a lot more support. So this notion reflects the idea that people might behave differently depending on where they are, because different kinds of situations contain contingencies. The kinds of activities you do at school might vary from the stuff that happens at home. The stuff you do with your friends, different than stuff you might do with family members. Different parts of our environments, are more or less likely to produce differences in how we behave, different kinds of reactions. And to the degree that you're using data sources that vary across these situations, not all of these ratings will produce valuable information, but a sizable chunk of them might. There's a lot of evidence to indicate that these kinds of differences, these ratings between different sources like parents and teachers and kids and peers, those spaces between the ratings actually relate to things we care about. Things like performance on behavioral tasks, clinical observations, readings for physiological devices, all kinds of different forms of functioning. And one of the great things about measurement is that it calls balls and strikes. If something's a bias, that means it's irrelevant, just like we've been talking about before. The word irrelevant is important. And if something's irrelevant, it can't really relate to things that you think are relevant. So when something relates to something you care about, it's no longer really a bias, at least in that specific circumstance. Lots of studies to support that. Here are a few. When kids are rated by parents and teachers, young kids, like 3, 4, 5 years old, on things like disruptive behavior, you often get different responses. And there's evidence to indicate that you can map on those differences, those times when parents say a child's disruptive, that the teacher says no, and vice versa. Those kinds of variations actually map onto actual behavior actual circumstances, actual variations in how kids actually behave with different kinds of authority figures, like you see on the screen. So you have chunks of kids there that behave disruptively in a laboratory-controlled setting with a parent and a non-parental adult, and vice versa. Those kinds of variations actually map on to independent, subjective ratings that parents and teachers give about how kids behave outside in the real world, at home and school. When parents and adolescents provide ratings at the beginning or at the moment of intake assessment for like administration into acute care, this is a time when kids are going through some rough stuff. You see the same kinds of variations in reports there, times where adolescents and parents agree, there's a lot going on here, we need help, and times when they disagree, where if, say, a parent indicates that my child's going through some rough stuff, and the child says, no, I'm not, right? I mean, even if they're lying, that space between those two scores actually tells us who's at risk for engaging in the kinds of behaviors in the facility, in the acute care facility, that force people to administer locked door seclusion to them, right? So like solitary confinement, to be administered standing antipsychotics. That space between the reports actually helps inform decision making to figure out like who might need some additional care so that they don't actually act up while they're here. In our lab, when we sort of think about these data sources almost like they're satellites. And when you try to find someone or try to get to a restaurant, you're not picking your favorite satellite, and that is Google. What they're doing basically is trying to figure out which satellites form a triangle around you so that we can lock in on your location. So by construction, the way we construct satellite arrays involves picking satellites who are just giving us different information. If we overlay that same kind of logic to how we gather subjective data, there's evidence to indicate that triangulated data source predicts observed behavior at ratings of, say, 0.4 to 0.6, and over and above not only each individual report, but the average of those reports as well. So actually finding that balance between what things share in common and what makes them unique, really, really valuable. We can even turn differences in rating behavior on and off. So like some of you use this rating of social skills called the Social Skills Rating System, Social Skills Improvement System, Frank Gresham's SSIS. So my colleagues and I took a bunch of those items and made videos out of them, and then pre-tested them to make sure that we created accurate videos of those items. And then we randomly assigned a sample of people to observe some behaviors that the other ones didn't, and some that they rated in common. We can produce effect sizes of plus or minus 3, 3 times what Cohen would say is large. And by just giving people, withholding access or giving access to viewing videos, you can turn this phenomenon on and off. Here's the neat thing: with the findings from that last slide, big variations in behavior, big variations in responses, presumably also big variations in item responses, different non-equivalent structures. All right, we created systematic differences in the reports. If you were to input those data into a test of measuring invariance, it would flag off all kinds of red lights. Danger, Will Rogers, danger. Get rid of those responses. Make things equivalent. That's what it would tell you. Now, that's clearly wrong. We intended to do that. There wouldn't be any reason to implement the test, and that might also go for when we think about using these tests and it's pre and post treatment, and it's an older versus younger child, and it's someone with a different, some people with varied racial ethnic identities, people with different gender identities. I'm going to show you a bunch of evidence and theory to back that up. All right. So Terry Moffat, decades of work studying the developmental course of antisocial behavior. And in her work, she has identified at least a couple of different pathways of exhibiting antisocial behavior. Some folks might be exhibiting these behaviors and over the course of long periods of time of their lives. Another group might actually be exhibiting these kinds of antisocial behavior patterns, and they're really specific to one period of development. You don't just see this in the survey data. You see this in the associated features and the characteristics of those two kinds of patterns. On the left side of the screen are the life course persistent kids, and then the adolescent limited kids. Very different patterns in social affiliation, in biobehavioral functioning, and a host of other kinds of tests, this would be one of the last places that you'd want to test measurement variance to ensure that people of different developmental peers have equivalent rating responses or measurement structures. We know from the developmental science that's just not the way antisocial behavior works. A couple of you raised your hands about depression and gender identity. You'd have to ignore decades of work on gender differences in the developmental psychopathology of depression and to be able to say that you should be making these conditions equivalent when it comes to gender identities and sex assigned at birth. And it's to our detriment, not just from a scientific standpoint, from an applied standpoint as well. This is a findings from a recent meta-analysis conducted by Maggie Price using John Weiss's meta-analytic database. What Maggie did was find state-by-state estimates of cultural sexism, so by all 50 states. And why is that? Well, controlled trials, they're contextually bound tests of whether or not interventions work, right? They all occur in a specific environment. And what Maggie found in John Weiss's data is that if you were an adolescent female receiving CBT for anxiety in New York City, you get the effects for CBT for anxiety that you'd expect from the meta-analysis. The effect size is 0.7, 0.8. An adolescent female who's receiving that same kind of intervention in a part of the country that's typified by high degrees of cultural sexism, the effects are flat. They don't actually look at all like the meta-analytic data, right? If you were to implement measurement and variance techniques here and make things equitable, these effects are likely gone because the key reason why that is because the same effect isn't found with adolescent males. Adolescent males, the effects are mostly the same for these different kinds of cultural environments. All right, these are the exact kinds of places you'd expect to see differences in item responses that might be occurring for good reason. Last place you'd want to do it. You see it also when it comes to work on structural factors in mental health. I mean, social determinants of health, decades of work indicating racial and ethnic disparities on a host of different kinds of factors, on risk and protective factors in terms of mental health concerns, access to high quality care, the effects of high quality care, variations across these, and you see the same kinds of effects in John Weiss's data that you see that I just showed you when it comes to gender identities. Same kind of thing. If you're an African American adolescent boy and you're receiving CBT for depression in a low cultural racism area, right? Same kind of effects you'd expect. High cultural racism area, effects are flat, right? And those effects you do not see with folks who share different kinds of identities. Again, if you were to implement measurement and variance tests here, you'd be essentially taking all the effects away. This applies to us in a really key way. Okay, so this is another page in Millsap's book on the second page. And I showed you a really great example that Millsap used earlier. The shape of objects, we know it doesn't impact weight. So if objects of different shapes that we know weigh the same actually don't weigh the same on the scale, there's a problem with that scale. Here's another example Millsap used about an appropriate way to use measurement variance. Depression. Males and females responding differently in depression. Millsap, in his own book, claims it's a great example of using to use measurement variance. Let me give you a brief biography on Millsap. Great educational background. Went to one of the best quantitative psychology programs on the planet for Ph.D. Trained with a major figure in psychometrics back in the day, and he himself became a major figure in psychometric and in particular measurement and variance. What he wasn't was a content expert in depression. He didn't know his developmental course. He didn't know the features that are relevant to understanding depression. He didn't know any of the things that anyone in this room knows, because that wasn't his job, right? And matter that also isn't the job of the techniques themselves. If you were to input data into one of these tests and produce a given set of results, the test can't tell you if it was the right place to apply it. And when it comes to mental health concerns, neither is the person who's doing the test. The quantitative methodologist on the team is unlikely to be a content expert. They might be, but they oftentimes are not. That's our job. So it's the quantitative methodologist's job, the content expert on methodology. It's their job to tell you what the options are. It's our job. If we have one job in this context, it's to engage in shared decision making with the quantitative expert, and to ensure that among the available options the quantitative expert is giving us, that we have a deep understanding of where things are appropriate to use, right? But in order for us to do that, it's important for us to know our history, to know the history of the work that we're doing, to do the hard work, the studies involved in understanding where, under what circumstances, techniques fit, and then when it comes time to actually using them, we ace our task. We actually do what we're supposed to do. I'm going to leave you with this one classic cartoon, and it's a cartoon that gets this idea of equitable selection and assessment. And it's a circumstance where a test administrator is asking a bunch of different species of animals to perform a task that's relevant to judging, in this case, their fitness or adaptation for their environment, and they're all being asked to climb a tree. If that's your one item for understanding the adaptive qualities of species, you'd be ignoring 2 centuries of evolutionary biology when administering this test. The last thing we should be doing is ignoring our own history as well. Thank you for your time, and I will leave this up here in case anybody wants to see that QR code again.
Thank you, Andy. That was great.